Hello, I'm Dr. Sindhu. I'm a consultant in Pediatrics and PICU at Aster RV, JP Nagar, Bangalore. Today, I'll be talking on H3N2 infection, that is a quite new buzz in the market. So what is H3N2? It is just like any other flu. It's also a flu infection which comes from which is actually a influenza A virus. It's not a new entity. It's been known in the environment for the last few decades. It gets transmitted from the pig to human. Every once in a while, it's been in the environment. It gives us severe infections and then it goes back. Like sporadically, it's keep coming. So how does it spread? Now H3N2, like any flu infection, it is also an airborne infection, which that means it spreads through droplets. That means when you can get it when you come in close contact with the patient who's already is infected, or whenever the droplets that are there on the surfaces, that is an infected surface, and you touch it and then again touch your face, mouth or eyes immediately after that. What are the symptoms that you can get when you are getting infected with the H3N2 infection, and what are to look out or the danger signs, and you have to come to the hospital immediately. Like H3N2 is like any other influenza or the flu infection, they can have fever with chills, or a stuffy or a running nose. Cough can be a major symptom, or body ache, headache, and especially in children who are less than 5 years of age, gastrointestinal symptoms, that is the vomiting or diarrhea, they can have present with. The vulnerable group at which it affects are children who are less than 5 years of age, or elderly people who are more than 65 years of age. Now, when do you have to get your child immediately to hospital is when you feel the child is not feeding at all, has reduced its intake completely, the child is very dull, not waking up at all, not being active at home. You find that your child is breathing very fast. Whenever the child is breathing, you can see the chest moving up and down, which we call as the retractions. Or you find the child is like as not normal as usual, or it's very lethargic. Then these are the danger signs when you have to get your child to the hospital. How is H3N2 diagnosed? Whenever you have your child with the above symptoms and signs, take the child to your doctor, and the doctor only will decide whether to send any swab or not. Like influenza viruses, H3N2 is detected through the nasal swabs, but only your doctor will prescribe you to whether to go ahead or not. How do you treat H3N2 flu infection? Like any other viral infection, this is also a symptomatic treatment. Majority of the cases are mild, so the symptomatic treatment includes take adequate rest, hydrate the child as much as possible. That means you increase the oral intake by giving lots of juice, water, tender coconut water, and keep the baby well hydrated. And if the child is having fever, consult your doctor and take the paracetamol as advised as per the weight. Now, in few cases especially, there are certain antiviral drugs like oseltamivir. However, these has to be taken only under the guidance of your doctor. Whenever you find any danger signs, it is always advisable to consult your doctor and take the treatment at the earliest. The oseltamivir or any other antivirals, they are known to, if taken within 48 hours, are known to reduce the symptom duration as well as the severity. So, if you find any of the symptoms, kindly visit your doctor and take the necessary steps. Is there a vaccine for the H3N2? As you know, there are annually every child will be given the annual flu vaccines. Now this flu vaccine is predominantly for influenza B or the H1N1 vaccines. However, it is advisable to take the flu shots annually, because it's not only one infection that is going to get infected, but enough number of flu viruses in and around us. So it's always better to get vaccinated, and taking prevention is always better than cure. How can it be prevented? H3N2 infection, it is an airborne infection, and all the measures of COVID-19 holds good even here. That is, wear mask whenever you're going to a crowded place. avoid the gatherings. Whenever you touch any surface or any infected areas, wash your hands. Wash your hands after using a washroom, before and after eating. So these are the preventive measures that you can take. Plus, yearly flu vaccine is advisable to take every year, the flu shots. To conclude, H3N2 infection is just like any other flu infection. So there is no need to panic. All you have to do is hydrate the child, take the required measurements as informed to you in the earlier. Whenever there is an infection, hydrate the child very well, give symptomatic treatment, that is for antipyretic, any fever medications, and watch for the danger signs. If any of the danger signs are there, then it's very much necessary to go to your doctor or the emergency department at the earliest. Here at Aster RV, we have a 24/7 running emergency department only for kids, so where we take care of such H3N2 children right from the diagnosis to evaluation and treatment.